Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of internal medicine is bladder and renal cell carcinomas. This topic we will discuss in 5 sections. In the first section we will talk about the epidemiology, pathology and pathogenesis of the bladder cancer. So how the bladder cancer, how common it is, what are the different abnormal changes in the bladder cancer and how it progresses, all that will be discussed in our first section. Then in the second section, we will discuss the clinical features, what are the signs and symptoms of the bladder cancer, how we can stage the bladder cancer, and also the diagnosis of the bladder cancer. In the third section or third portion of our lecture, we will discuss the different treatment options of the bladder cancer, which will be non-muscle invasive disease, muscle invasive and metastatic disease, and also the chemotherapeutic treatment of the bladder cancer. Then after this, we will move on to renal cell carcinoma, epidemiology, pathology, and clinical presentation. And then in the fifth and final section, we will talk about the staging, prognosis, and treatment of the renal cell carcinoma. So in our today's lecture, we will talk in detail about the two common carcinomas, the bladder cell carcinoma and the renal cell carcinoma, and how they are diagnosed, managed, and how the patient with these two carcinomas present. So keep watching sqadia.com to learn this lecture.